Good morning.
Hola, mi amigas.
Happy Saturday.
For real. That's what we're doing already.
Hey,
It's going all the way down.
I was just gonna say, about to
Oh
set
my
this place
God.
off.
Oh my God. You ready? Oh my goodness. Well, welcome everybody to a very special preview of our meeting after the meeting. Let me just tell you this right here. This is where, first of all, let me say it in a nice professional way. This is where we provide additional commentary. In other words, this is where it really goes down. To sum it up. So as you come in, don't forget to hit the thumbs up and like button. We appreciate that interaction. I'm Clarice Warner. I'm the Grow with the Pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And joining me today is my partner in success, my co host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, you can feel free to introduce yourself and tell the folks all about you.
good morning, everybody. My name is Jesse. I live in Philadelphia. I have been in healthcare for a very long time. In 2014, I transitioned away from the bedside into risk adjustment coding. During the pandemic in 2020, I created a company, the Coding Nurse LLC, where I help nurses and other people in healthcare with a clinical background transition into the wonderful world of HIM.
All right, all right. And how is it going?
Well,
Yes, it is. And also joining us is our on the street correspondent, the crafty coder. Ma'am, introduce yourself and tell the folks all about you.
Oh, yes. My name is LaShante. I've been in coding and billing since 2012. I've done everything in the revenue cycle you can think of. In 2021, I went ahead and opened up LA Burgess LLC so that I can start bridging the gap between healthcare professionals, billers, coders, and the insurance companies.
Well, look at you. Look at you. Gap Bridger. Gap Bridger. All
mhm.
right. So if you are new to us, new to our platform, new to the meeting after the meeting, because you're getting this little sneak preview, let me remind you that you can join in on the fun. Use the chat to add to the conversation. Don't be shy. We want to hear what you got to say. We gonna say what we say, but we love to hear what you have to say. So
Mhm.
join us in the comments as well. So let me just start off with, I don't know if y'all have seen this, but our friends over at the OIG has been OIGing. So much so, I have never seen anything like this before. In all of my 20 plus years in the field. But you know how I'm used to seeing uh millions of dollars of repayments or billions of dollars of repayments. Um, I saw a $20,000 repayment with jail time from the
Oh,
OIG. Girl,
oh, it
said,
wasn't even it wasn't even worth you doing it. You should have just stayed over there and just did what you were supposed to do. That's wild.
for real? I'm like, oh, they not playing with Karen, Tracy, Bob, Lamar. They not playing with none of y'all. If they come in for
I was
$20,000.
just thinking, like, that's PPP level prosecution.
That's what I'm saying. Like, it's like, what was? I can't wait to hear this. What was you doing that you decided that that was how you was gonna risk your life?
Ma'am. So let me just state they were in your state. They
See,
was in your state of Florida. Um, it says Attorney General Moody announces arrest of owner of caregiving company for a little more than $20,000 in Medicaid fraud. Mm-mm-mm. I said, oh wow. Um, the person Jasmine Victoria Stanley, they hit the whole name. Like, you know how normally, like, people who do heinous crimes, they give you like the whole, they hit the whole name. Like, we not playing. We gonna let y'all know no amount is too small for us to come after. Anyway.
And put her whole name out there like there's no doubt. Like you be like, is that Karen's daughter? Yes, it is.
Absolutely.
You know it's
Mhm.
there. Oh wow. So um she's the owner of a caregiving giving company who intentionally double billed the Florida Medicaid program for services not requested or rendered by the recipient. So the thing was, I guess at some point during their investigation, they started seeing this. They done reached out to the recipient's family
Oh.
Mm.
and had a conversation. And the family was like, we didn't need her for these days. And then the family had, wait a minute, the family
No.
had receipts. Let me just tell
Oh
you.
no.
So there were phone calls and text messages and all of the voicemails and all of the things to tell her, ma'am, our recipient, the recipient is sick. You don't need to come. Or we are out of town. We won't be here. She billed for those days as well.
Oh,
Oh, see, yeah. So she was supposed to get it. Was supposed to happen. Yeah, if it could have been $10 and you that was supposed to happen. That's crazy.
But
yeah,
the
she got great.
$21,000, I was like, they really they
I
using
mean, what was the
the
rest of
good
your income for the
good
rest of the year,
government
though?
money for
Jesus.
resources for they don't care. We collecting it all right now. We not care. We want all our money, every single dime from anybody.
But $20,000 though, do you know? Do you know that's like I don't even know. That's like part time at McDonald's. You could have made that in Uber though. The
Well, she
days
also
that
got
you
a
didn't
second degree felony. She got a felony attached to this on her name,
see what I'm saying?
and she
Probably
faces
because
up
it's
to
over a certain amount, right? She got the felony because it was over a certain dollar
it's
amount.
Yeah.
Medicare provider fraud over $10,000, which is a second degree felony, and she faces up to 15 years in prison if convicted.
If no, she's gonna get convicted because they got the receipts. I
They
mean,
got
that's
the
crazy.
receipts.
I'm
They got
sure
the
it's going to be
receipts.
a free bargain.
I'm sure, but was it? I mean, is it worth it?
Posting, oh,
Is
tink
it
tink.
worth it?
Mm-mm-mm.
Poor. Like, didn't nobody tell you that they for real out here in these streets and will come for every dime that. Yeah, but I was just tickled. Like, wow, 21,000. I was like, am I reading this right?
She was
Are they
being
missing some
bold.
zeros?
She hadn't got on their nerves with that one. They was feeling some kind of way on
I'm
that
like,
particular day
oh
when they didn't have nothing else to do.
my goodness. Yes. Oh, let me. Good morning, Tiana. Welcome, welcome.
Good
All
morning.
right, all right. So
Good
yeah,
morning.
so I just thought that was, and then the other thing that I saw, and then I'll let y'all have at it. Not only are they coming for the people, they coming for the states. So New
Mm,
Mexico.
mm.
Now they didn't have any monetary things on here, but they strongly had some conversation with them over $2.7 million paid on PCS encounter claims where the qualifications of the attendants who provided the services, they weren't right. They weren't right. They didn't do background checks on these people.
Oh,
They didn't do um abuse registry checks. They didn't check for tuberculosis. They didn't check whether or not they were competent, so they didn't do any written competency tests. They didn't provide annual training. They didn't make sure the folks had CPR and first aid certifications. These folks out here wilding in New Mexico. I mean, I understand that getting uh, these providers is kind of slim. Folks not don't want to work now or whatever. But you just gonna let anybody come on and fool with Granny? Anybody?
but
I said,
there's
wow.
basics of care. There's basic stuff like I don't want somebody that I didn't background check in my house personally. You know what I mean? Like I want even if I didn't background and check them myself, I
But
kind of want somebody else to have done it.
you trusting that the state is going to make sure that they put out the information on people if they have issues in their background check or if they
Right.
are uh excluded or suspended or any of those things, you would think the state um Medicaid organizations who's relying also on the state for information would have this. They didn't. They didn't.
But
And so they
tuberculosis, though, like
did
we just
like
didn't take time out for that.
they did
Hmm.
300 claims. They reviewed 300 claims, and 194 of the claims had issues where the attendants did not meet one or more requirements. I'm like, that's a lot. That's a lot. That's a whole
And
lot.
that's just lazy.
That's lazy. That's lazy. Good morning, Pam. Good morning. Welcome, welcome. Good morning, Carolyn. Welcome, welcome. You
Hey,
missed
Carolyn.
the Spanish opening. He had a whole opening in Spanish as he prepares. So yeah, I saw that today or yesterday, and I was like, "Boy, they out here. Y'all better get it right. Y'all better help y'all people get it right. And if you one of the people that's out here, you better get it right, cause they coming. They coming. So how y'all be week being? Or go ahead, Mr. Chester. Were you saying something?
I would love to know what the, like, because I'm going to tell you, I'm still stuck at the
20.
21,000.
Right.
They, wow. And the
I'm not
crazy,
mad though. I ain't mad at all
oh,
I get it, but don't you got more things to go for? Don't you got some higher dollar, higher ticket items to use those resources on? Maybe,
and
I don't know.
that's my point, because I have seen cases, I've seen myself that have been more than that are questionable.
I
I'm like,
said, "Woo, mm." Like what triggered what pulled her card? What she do to pull her card? Because they came
I,
for her.
this sounds this sounds personal, and somebody told on somebody.
Somebody,
That
the,
that's what that
the
is.
snitches was snitching. The snitches was snitching.
Because I'm like, they not
She
the
probably
government.
had a bad attitude when she was going in there, being doing whatever she was doing. You know what I mean? Like it was something else that made somebody go the extra mile
Oh yeah, yeah, yeah.
for that because somebody else was paying this bill at this point. It wasn't something that was coming. You know what I mean? Like I feel like she probably was doing something else crazy in the background, and they just went ahead and said, "Hey, you know what? We got this chick over here that's doing," and then they went back and said, "Okay,
Somebody called 888 Screw Whitney. That's what they.
yes,
That's what,
yes,
Yes, Miss Carolyn. I'll put the link in the Patreon. So for all the tea sippers that are normally part of our meeting after a meeting, I'll definitely put the link there. Yeah, that was crazy, crazy.
right."
I just noticed our color coordination this morning.
Oh, look.
I
And
know,
I
right?
Okay.
have to put on my headphones too to
Look at
match.
y'all. Look at y'all with your headphones. Look at y'all. Look, I'm listening to airport headphones, and y'all got the things. Look, y'all better do it.
I usually have these, but these are the ones that give me the problem. So I was like, nah, let me put on my beats today. Cause them are
Look
the
at
ones I gotta
y'all. Y'all
unhook. I gotta
grown.
hook all the unhook all the monitors
Y'all
up and
grown.
mm-mm.
And Crafty Color, I don't know if you have a YouTube account or channel, but you can send this to your channel so your people can see this as well if you
Okay.
want to while we out here on this preview of what the meeting after the meeting looks like and sounds like. Yes. Okay, so what's the what? Y'all know y'all got something
Well,
that's
I
appropriate for this
yeah,
preview.
Right.
Everything ain't for everybody.
there you go. But I did hear that through our CDI buddy Glenn Krause, we
Mhm.
need we need a name for him because he is a hoot. That's all I can
He
tell
is
you.
off the chain. When you hear him,
Hilarious.
off the chain. I
But
love him though.
I found out from him that CMS is testing a new payment methodology. It's,
Really?
yes, they have 741 hospitals that are going to be pilots for this. The acronym is TEAM, and what
Okay.
it is they have certain categories, like hip replacement, um, osteoarthritis, certain procedures that these hospitals are going to be a pilot in, and they're going to receive money for the patient's procedure and aftercare specifically related to those surgical procedures. And I'm
Are they
like,
going to be inpatient? Are all
and
these
patient,
inpatient only? I wonder if they're
yeah,
inpatient only procedures.
they
They're
are.
monitoring them and watching them. Because I remember once upon a time they were stripping all of them. That one year, that one year they took everything off of the inpatient only list, and they were going to do away with it. And folks went ballistic and up in arms. And the very next year, they all those codes came right back, and the list has been there ever since.
Because I think that they're trying to see with these cases, like, could, like, do they have to be, probably.
This is probably what they should have
Testing it
done
out.
before they stripped them off. Because, like I said, folks went bananas. Like, no, this is we need this. We got to do this. Da 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 da. You can't. And the outpatient people was like, come on. The surgery centers were like, yeah, let them go, let them go. We got you, we got you. And then they were like, I guess the hospital associations had probably more money, and they lobbied a little harder, and they were like, oops, our bad. We're bringing them all back.
Because the only thing about, outpatient procedures is, I mean, of course, with any procedure, you run the risk of complications, but I've seen some outpatient procedures with some very, very bad complications that aren't
Mm-hmm.
necessarily expected.
Yep.
And it's like they come to the ER a complete mess.
Mm.
I mean,
I
right
think.
after the procedure, like vascular procedures where they have internal bleeding, all
Mhm.
kinds of hypovolemic shock, all kinds of stuff.
Mm. That's
I
crazy.
think I think certain procedures should just only, even if you could have done it safely outpatient, I think they should be inpatient because it just requires a different level. Like, unless you're just going in and getting a DNC or something, or just getting your toenail debrided, I feel like you should have the patients in there, because the way that the economy and how everybody's health is right now, what happens if something take a drastic turn at a ambulatory center? You know what I mean? Like, you got to stop everything. You got to stop the whole production and then shoot them over there, because most of the time orthopedics, that's where they try to be at, the ambulatory center, not necessarily at the hospital all the time, unless the patient has comorbidities that force them to have to be into the hospital and be inpatient.
Yeah,
I
I
don't know.
think I appreciate that they are doing this testing early on, because in some cases there are times when a hospitalization may not be necessary, and the
Hmm.
cost of inpatient care is so expensive and rising. And you run into, is this going to be covered, is it not, and then the patients end up paying for that. So I feel like the option of, again, once they test to see whether or not it truly needs to be something that has to be
Right.
inpatient, I think the option of having these surgical centers or outpatient locations have a part of that is good. I think it's good for it's good all around. Um, because at least the ones that I'm familiar with, they are, they're not just like some fly by night. Look, I'm about to throw somebody under the bus. Urgent care kind of thing. They like for
Right.
real. They like real. You know what I'm saying? They have the expertise, the team, the people. They know what they're doing. Like you said, especially orthopedics. And I'm thinking about the hip replacement kind of thing. Especially as we are in the decade of the baby boomer, because they everybody out here and they booming,
Right. Right.
and they
So
getting
Booming and
replacements.
having catching stuff on the side, because they booming too much.
I pulled it up on LinkedIn, and it says The team stands for Transforming Episode Accountability Model,
Okay.
and it
Did
will
you
begin.
post it in the thing?
No, I will.
Okay.
And
Oh, well, we could do it when we come back.
it'll begin January 1st, 2026, and last 5 years. And it says
Cool.
Mm.
hospitals for
And how many
selecting.
they get?
Thir- uh, you mean how many hospitals?
Uh-huh.
Oh, 741.
That's a lot.
Yep. And it says the model was designed based on lessons learned from previous models of input from stakeholders. Selected hospitals will coordinate care for traditional Medicare beneficiaries undergoing certain procedures and be responsible for the cost and quality of care for the surgical episode, as well as 30 days after patients are discharged from the hospital. The procedures within the bundle are lower extremity joint replacement, hip femur fracture treatment, spinal fusion, coronary artery bypass graft, and major bowel procedures.
I knew
And
ortho
they
was
e-
gonna be in there somewhere.
and they even list the all 741 hospitals in their.
Oh wow.
And this is on, of course, our people at
Lynn.
Becker's
Oh, is
and
it?
from.
Okay. 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 All right. Yeah. We'll definitely link that information in. Cool.
So something
And I
crazy.
posted in the comments. Do people?
I don't
Do
see it.
people? Okay, hold on. I just did. Well, it's
There we
posting
go.
now.
There we go.
Okay.
There we go. So check the comments. What were you about to say, Miss Mimi?
So I was reading, I'm always on Facebook. So it says the headline was Alabama man dies when Florida surgeon allegedly removes wrong organ.
I
He
saw
went
that.
in. He went in for his spleen. Tell me why they removed the man's liver
Yep.
and he
Because
passed
they don't
away.
know they right from they left when they looking at the person. Wow. But they don't look alike though, right? Like
I had so many questions because don't you do a check at the beginning to locate? You got to do the side of the body. This is the patient. This is what we're here for. Where did spleen turn to the liver? I was like, oh, poor people. And they were visiting they weren't even from here. They were on vacation
mm,
and he just doesn't come back from vacation.
mm.
Now that's even wilder because
He doesn't. He's not from the States or not
he's
from the area.
he's not from Florida. He's from Alabama, I believe it
Oh, he
was.
was from a different state. Oh, I'm thinking
He
like
just was on vacation in the
international.
Panhandle.
Oh my God.
Yep.
But
I was like, oh really?
to make the story even worse, that particular surgeon had a sketchy past.
So why is he
This
working?
wasn't-
Why is
exactly.
he? Why? It's so that hospital.
And their comment was, "We don't comment on current cases."
Of course
No,
they
you need
don't.
to tell something. You
Or
need to tell somebody because right now everybody need to be outside your hospital picketing because he don't need to be there, and
They don't
he
have to
probably
pick
one of
it.
the ones.
They about to hit everybody in their pocket.
He probably one of them ones that he know everything and can't nobody tell him nothing.
and he probably, because all that is that somebody who has terrorized their OR staff and nobody says anything. Because
That's
Exactly.
right.
it's a whole lot of people involved in that. You're
That's
Yep.
supposed
right.
to do. I mean, I can't tell you. We all have read op notes where they do a timeout
Mm-hmm.
and they verify everything before they start.
Mm-hmm. Mm-hmm.
Ascension Sacred Heart Emerald Coast Hospital, and it happened 2 weeks ago.
Is he still on staff? They say anything about him?
They don't know. They when they got ready to ask, I don't think they came to that conclusion. That's where they said, somebody said all the doctors that I speak to say it's virtually impossible for a surgeon who's board certified in general surgery to mistake a liver for a spleen.
That's what I'm saying. They don't even look like what who does that? Unless he was
Says we do
high
not comment on specific
or
patient
drunk
cases
or
or active litigation.
but even like if the police have an incident, like they'll let you know that they're on desk duty or have been, put on leave or whatever. They should let somebody know because who would not want to have any procedures anywhere near that place if that person is still there would be me.
They said he bled to death on the table. My thing
Of
is,
of course
I
he did.
right. I don't have to be a surgeon to know that. I mean, who's living without a liver at this point?
The hospital removed him from their website, is what I heard, but he had done previous things in the past.
Hmm.
They
So he
need to
got
do more than
bodies.
remove him
He
from the
got bodies on
website.
him. Do he got teardrops on his face? He got bodies on him, huh?
Yeah, he does.
He got bodies.
Did they
Oh
even say
wow.
how old he was? I know that the patient was like 70. I don't think they said how old the doc. I'm just one man. Mm-mm-mm. I was just like, I can't imagine if I was his wife. Oh, we going for blood. I'm talking about all the blood that's on the table for my husband is what I'm coming after.
Oh, that's
Oh,
in the
his veins
bag.
in it. Yeah,
They, they
that right there, because that don't that to me that doesn't make any sense. It's not.
Exactly, Kim.
Mm-mm.
I'm still. But
Yeah.
so there's even more
Yeah.
to this because you got a team of people in there,
a team.
a whole
And,
team of people, and ain't nobody saying nothing.
and he should not be, even though he is wrong as two less shoes, he should not take the fall by himself. Everybody in that
Absolutely, everybody in there, because
every nurse needs to lose their license. Every other
everybody,
doctor needs to lose theirs.
But the thing,
everybody.
and they named it. So once they took the organ out, right? They named it spleen.
Because they're trying to cover it up at that point.
The hell. Mm-mm.
I mean, that's just basic anatomy. But see,
Basic.
what I'm also, and of course, they would never do it because of he's a surgeon at the hospital, but they should have done um, some kind of, they should have done a urine and a blood toxicology because he had to be under some
Immediately,
kind of influence.
immediately,
Exactly.
Well,
immediately.
on him and everybody else, because at this point, I'm just trying to figure out why nobody said, "Hey, wait, doctor, y'all that scared? Everybody should be losing it." Because I don't understand what's the point in it. At this point, what was the purpose of your timeout? What the hell was y'all doing at the timeout?
Did they do one? That's the thing.
Right.
Mm-mm.
They never said if they did one, but I just know from reading art reports like you time out to do whatever you do on timeouts, which is usually to say you're on the right side of the body or the left side of the body, the right leg, left leg, spleen, not liver.
I mean,
Mm-mm-mm-mm.
it's not even like it wouldn't have made it any better, but it's not even like they nicked the liver and he bled to death.
They
I mean,
removed the whole dang
exactly.
thing.
Mm-mm-mm. That's horrible. She said, I've never been in operating room. Are there people seeing what he's doing at the time? The team,
Mm-hmm.
And it was
I've been in
similar to
one,
what
and
you
you're
see
looking
in
right
the
at it,
in
just
the
like this.
yeah, similar to what you see on TV, where you have a team of folks standing there. I mean, everybody over this body. There's people over this body watching what is
A
actually going on.
production and screens
yeah,
everywhere.
because I'm sure it was done laparoscopically. I mean, I can't
Oh,
imagine it being
child.
open. I
Mm.
mean, it may have been, but whatever, however they do it, it's you can see it.
Well, y'all hold that thought because our preview time is up. Hold that thought because I'm sure there's more to discuss as it relates to this. So, we want to thank you all for joining us. If you want to get more of the meeting after the meeting, feel free to become one of the T sippers. Let me find my little thing. Y'all done had me all discombobulated with this story. Lord Jesus. I think it's this one. Because I changed. Is it this one? It's this one. Look at our new thing down here. All right. Look, I've been doing some work. I've been trying.
Mhm.
So, are you thirsty for fresh perspectives on the healthcare revenue cycle? By becoming one of the PRNT sippers, you'll join a community of sharp minds who savor the complexities of the healthcare revenue cycle. Why sip alone when you can steep in knowledge when we can steep in knowledge together? Come, let's spill the tea on industry insights. So this is what you can expect as a valued member of the Tea Sippers. Exclusive healthcare insights so you can gain access to in-depth articles, webinars, and resources covering the latest healthcare trends, compliance updates, and revenue cycle best practices. Early access, you'll be the first to receive expert insights and guides, ensuring you stay ahead in the ever evolving healthcare industry. Personalized support. Enjoy direct access to our team of experts for guidance on medical coding, compliance issues, and revenue cycle management. We're here to answer your questions and support your professional growth. And my favorite part, the community connection. So join a private community of healthcare professionals where you can network, share experiences, and collaborate on finding solutions to common challenges. So by supporting us, you're not only advancing your healthcare knowledge and career, but also contributing to the success of PRN, which is a resource that empowers healthcare professionals like you to thrive in their roles, goals, and dreams. So thank you for considering becoming a member of the PRNT Sippers. You can check us out at bit.ly/the PRNTSippers.com. Yes, 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 yes. So, your support means the world to us, and we look forward to helping you excel in the world of health information and healthcare revenue cycle. So, thank you for being a part of our preview. Our regularly scheduled programming will begin in about 5 minutes. So, to our PRNT Sippers, make sure you go out to Patreon, get your link, and we'll join you over there uh shortly. Do you guys have any additional comments, commentary? Hopefully you got something out of this information. You got to see a little behind the scenes of what we do and how it all goes down. No?
I
Y'all
don't have
silent?
it. Yeah. I'm
Y'all
getting
just ready to jump in. I know, I know. I know I'm messing up the flow. I know, I feel it. I'm sorry. Well, again, if you want to get more, so stay tuned to part two. Go out to the bit.ly link and join the PRNT Sippers, and you can get the information and the link to join us for part two. All right. See you all next week. Thank you. Thank you.
Bye bye.
Bye bye.